Thrombocythemia Unleashed, Platelets Out of Control? Uncover the hidden risks and new approaches to tame this blood disorder. When it comes to health, we often hear about low blood counts, anemia, low platelets, or vitamin deficiencies. But what happens when your platelets multiply out of control? That's the hidden story behind thrombocythemia, a rare but serious blood disorder that turns your body's natural healing system into a potential threat. What is thrombocythemia? Thrombocythemia, sometimes called essential thrombocythemia, ET, is a condition in which the bone marrow produces too many platelets, the tiny blood cells responsible for forming clots and stopping bleeding. While normal platelet counts range from 150,000 to 450,000 per microliter of blood, people with thrombocythemia can have up to 1 million or more. At first it might sound harmless. After all, platelets help prevent bleeding. But when too many are circulating, the blood becomes more likely to clot in the wrong places, leading to dangerous complications. Why it's a hidden risk? The biggest danger with thrombocythemia is abnormal clotting. Clots can form spontaneously in blood vessels, blocking blood flow to vital organs. This can lead to stroke or mini-strokes, TIAs, heart attacks, deep vein thrombosis, DVT, pulmonary embolism. In other cases, platelets can paradoxically cause bleeding, especially when their function becomes irregular, a confusing and dangerous dual effect. What causes it? In many cases, thrombocythemia arises from genetic mutations in bone marrow stem cells, particularly in the JAK2, KLR, or MPL genes. These mutations cause the bone marrow to ignore normal control signals, producing excessive platelets that don't behave properly. Unlike secondary, reactive thrombocytosis, which can occur due to infection, inflammation, or iron deficiency, essential thrombocythemia is a chronic condition, often lasting a lifetime. Who's at risk? Thrombocythemia is more common in middle-aged and older adults, especially women. However, it can also appear in younger people, often discovered incidentally during routine blood tests. Risk factors include family history of bone marrow disorders, chronic inflammatory diseases, smoking, or cardiovascular issues. Because symptoms can be mild or non-existent early on, many people live with the condition without knowing it. Symptoms to watch. For some, warning signs include persistent headaches or dizziness, numbness or tingling in hands and feet, unexplained bruising or bleeding gums, vision problems, fatigue or weakness. If left unchecked, these symptoms can progress to more serious complications involving the heart, brain, or spleen. New approaches to treatment. Treatment depends on your platelet count and risk profile. For many people, low-dose aspirin helps reduce the risk of clots. In more severe cases, medications like hydroxyurea or anagrelide may be prescribed to slow platelet production. Recent advances include targeted therapies that act on specific genetic mutations, offering more personalized and effective management. Lifestyle also matters. Maintaining a heart-healthy diet, regular exercise, hydration, and avoiding smoking all help keep the blood flowing smoothly. Hope from research scientists are now exploring JAK inhibitors and novel gene-targeting drugs to correct the root molecular causes of thrombocythemia. Clinical trials are promising, signaling a future where patients may not just control their platelet counts, but restore balance to their bone marrow's function. The takeaway: thrombocythemia may be rare, but its impact can be profound. Unchecked, it turns life's simplest blessing, blood flow, into a silent hazard. Yet with early detection, genetic testing, and modern medicine, this once mysterious disorder can be tamed. So if fatigue, headaches, or unexplained clotting seem to linger, it's worth asking, are your platelets trying to tell you something? Because in the quiet currents of your bloodstream, even the smallest cells can cause the biggest storms.